Welcome to our exploration of supply and demand in the medical market. In this video, we'll break down how these fundamental economic forces shape the healthcare industry. From the availability of doctors and medicine to the prices patients pay, supply and demand play a crucial role. Understanding these concepts can help us see why some treatments are expensive, why shortages happen, and how policy changes can impact everyone. Let's start by defining what we mean by the medical market and why it's unique compared to other industries. Supply in the medical market refers to the total amount of healthcare services, professionals, and products available to patients. This includes everything from hospital beds and medical devices to doctors, nurses, and medications. The supply side is influenced by factors like production costs, technological advancements, and the number of trained professionals. When supply is limited, it can lead to higher prices and longer wait times for care. Let's look at how supply is determined and why it can be difficult to increase quickly. Demand in the medical market is the desire and ability of patients to seek healthcare services and products. This demand is shaped by factors such as population size, age, income, and the prevalence of diseases. When more people need care or when new treatments become available, demand rises. However, not all demand is met, especially if supply is limited or prices are too high. Understanding demand helps explain why some services are more popular or why certain medications are in short supply. Medical market is different from other markets because of its complexity and the importance of health. Unlike buying a car or a phone, patients often don't have complete information or the ability to compare prices easily. Insurance, government policies, and ethical considerations also play a big role. These factors make the supply and demand relationship in healthcare more complicated and sometimes unpredictable. Let's explore what makes the medical market so unique. Prices in the medical market are influenced by both supply and demand, but also by regulations and insurance companies. Unlike other markets, patients rarely pay the full price directly. Instead, insurance and government programs often cover a portion of the cost. This can lead to higher overall prices, as providers and manufacturers negotiate with insurers rather than patients. Understanding how prices are set helps explain why healthcare costs can vary so much. Sometimes, the medical market experiences shortages or surpluses. A shortage happens when demand exceeds supply, leading to long wait times or unavailable treatments. Surpluses occur when there are more services or products than needed, which can waste resources. These imbalances can be caused by sudden disease outbreaks, changes in regulations, or shifts in population health. Let's look at some real-world examples of shortages and surpluses in healthcare. Technology plays a major role in shaping both supply and demand in the medical market. New medical devices, telemedicine, and advanced treatments can increase supply by making care more efficient. At the same time, technology can boost demand as patients seek the latest innovations. However, new technology can also be expensive, affecting prices and access. Let's see how technology is changing the landscape of healthcare supply and demand. As populations age, demand for medical services increases. Older adults typically require more healthcare, from routine checkups to complex surgeries. This rising demand can strain the supply of doctors, nurses, and hospital space. Countries with aging populations often face challenges in meeting these needs, leading to policy changes and innovations in care delivery. Let's explore how aging impacts the balance of supply and demand in healthcare. Key challenge in the medical market is the shortage of healthcare professionals. Training doctors and nurses takes years, and shortages can develop quickly if demand rises or professionals retire. Workforce shortages can lead to longer wait times, higher costs, and increased stress for existing staff. Addressing these shortages often requires investment in education and incentives for healthcare workers. Supply of medications depends on complex global supply chains. From raw materials to manufacturing and distribution, any disruption can lead to shortages or delays. Factors like regulation, transportation, and international trade all affect the availability of medicines. Understanding pharmaceutical supply chains helps explain why some drugs are hard to find or suddenly become expensive. Insurance plays a crucial role in the medical market by affecting both supply and demand. With insurance, more people can afford care, increasing demand. However, insurance companies also negotiate prices and set coverage limits, influencing what services are available. The balance between access and cost is a constant challenge in healthcare systems worldwide. Governments regulate the medical market to ensure safety, quality, and fairness. Regulations can affect supply by setting standards for providers and products. They also influence demand by funding public health programs and insurance. While regulation can protect patients, it can also create barriers that slow innovation or limit supply. Let's see how regulation shapes the medical market. Some countries use price controls to keep healthcare affordable. These controls can limit how much providers and drug companies can charge. While this can make care more accessible, it may also reduce incentives for innovation or lead to shortages if prices are set too low. Price controls are a balancing act between affordability and encouraging supply. Private sector is a major player in the medical market, providing hospitals, clinics, and pharmaceutical products. Private companies often drive innovation and efficiency but may focus on profitable services. This can lead to gaps in care for less profitable treatments or underserved populations. The interaction between public and private sectors shapes the overall supply and demand. Emergencies like pandemics can dramatically shift supply and demand in the medical market. Sudden spikes in demand for care, equipment, and medications can overwhelm supply chains and healthcare systems. Governments and organizations must respond quickly to balance these forces and ensure access to critical services. The COVID-19 pandemic is a recent example of these challenges. Medical innovation and research can increase supply by developing new treatments and improving efficiency. However, research is expensive and risky, and not all innovations reach the market. The promise of profit can drive investment, but regulations and market size also matter. Let's examine how research shapes supply and demand in healthcare. Healthcare is increasingly global, with medical tourism, international supply chains, and cross-border research. Patients may travel for care, and medicines are produced and shipped worldwide. Globalization can increase supply and lower costs, but also introduces risks like supply chain disruptions or uneven access. Let's look at the global dimension of the medical market. Ethics play a significant role in the medical market. Decisions about who gets care, how resources are allocated, and what treatments are offered involve complex moral questions. Balancing profit, access, and fairness is a constant challenge. Ethical considerations can influence both supply and demand, shaping policies and practices across the industry. In the medical market, patients often have less information than providers about treatments and costs. This information asymmetry can lead to inefficiencies, higher prices, or unnecessary treatments. Efforts to improve transparency and patient education are ongoing, aiming to create a more balanced market where supply and demand can interact fairly. Preventive care, like vaccinations and screenings, can reduce demand for expensive treatments by keeping people healthy. Investing in prevention can shift the balance of supply and demand, lowering overall costs and improving outcomes. Public health campaigns and education are key tools in promoting preventive care. Managing chronic diseases like diabetes or heart disease is a major driver of demand in the medical market. These conditions require ongoing care, medications, and monitoring, increasing the need for healthcare resources. Effective management can improve quality of life and reduce long-term costs, but also puts pressure on supply. Data and analytics are transforming the medical market by helping providers predict demand, manage supply, and improve efficiency. Electronic health records, big data, and artificial intelligence allow for better planning and resource allocation. These tools can help balance supply and demand, leading to better outcomes for patients and providers. Access to healthcare can be limited in rural or remote areas where supply of providers and facilities is lower. This can lead to unmet demand and poorer health outcomes. Solutions like telemedicine, mobile clinics, and targeted incentives are helping to bridge the gap and improve access for rural populations. Supply of healthcare professionals depends on education and training systems. Medical schools, residency programs, and continuing education ensure a steady flow of qualified providers. Investments in education can help address shortages and improve the quality of care, directly impacting the balance of supply and demand. Nonprofit organizations play a vital role in the medical market, especially in underserved areas. They provide free or low-cost care, fund research, and advocate for policy changes. Nonprofits help fill gaps in supply and ensure that vulnerable populations have access to essential services. Patient preferences and expectations influence demand in the medical market. As people become more informed and proactive about their health, they may seek specific treatments, providers, or technologies. Meeting these preferences can drive innovation but also challenge providers to balance resources and costs. Market failures can occur in healthcare when supply and demand do not lead to efficient or fair outcomes. Examples include monopolies, information gaps, and externalities like public health risks. Addressing market failures often requires government intervention, regulation, or public funding to ensure access and quality. The future of the medical market will be shaped by trends like digital health, personalized medicine, and global collaboration. These trends can increase supply, improve efficiency, and change the way patients access care. Staying informed about future developments helps us understand how supply and demand will evolve. Balancing supply and demand in the medical market is an ongoing challenge. Policymakers, providers, and patients all play a role in finding solutions. Strategies include investing in education, embracing technology, and designing smart regulations. Achieving balance ensures better access, quality, and affordability for everyone. In summary, supply and demand are at the heart of the medical market, influencing everything from prices to access and innovation. By understanding these forces, we can better appreciate the challenges and opportunities in healthcare. Whether you're a patient, provider, or policymaker, staying informed about supply and demand helps us all work towards a healthier future.